I said before, just a real inspiration to every person that he meets and educates about these important issues. So it is my pleasure to present him with the 2019 Vernon Johnson Individual Recovery Advocate Award.
You didn't see that coming, did you?
I did see that coming. Thank you all very much. I have a person in long-term recovery, and that means to me that I have not had to use a drink or a drug since the age of 21. I consider myself also a formerly young person still in recovery. I want to thank you all for saving my life. I'm not supposed to choke up. I don't have time for that tonight. Because I know that there are people in this room that came before me. So when I walked into treatment, and when I got help, and the recovery community embraced me and brought me back to life, that there are people in this room that had spent many decades making sure that the things that I needed when I went for help were there. Because I was a 21-year-old young man who thought my life was over. I could see my death. I barely graduated high school, and I knew that I was not going to live very much longer. I was without hope. I walked in to get help, and quite frankly, one of the first things that I asked in as subtle manner as possible, because I didn't really know anything about treatment other than Betty Ford. I knew that rich people got treatment. I didn't think that people like me could go get publicly funded treatment, which is where I got better. I walked in there and I essentially asked this person if they were a narcotics agent. Because I needed to know if the things that I was going to say there were going to stay there. And if the things that I had to say, I could say in a way that I could get better. And they assured me that I had control over my information and that it wasn't going to go anywhere unless I said so. And that allowed me to form a therapeutic alliance. That allowed me the ability to form the ability to trust. And I learned about myself, and I learned about my community. And I thank you for giving me purpose. Because if it wasn't for some people in this room, I know that I wouldn't be alive today. So thank you all. Having said that, I want to talk a little bit about what kind of things that we face. You know, I learned along the way about some of the remarkable things that people had done so that I could get help. You know, you realize that in my lifetime, up until then, we'd come from a point where people were getting lobotomies and electroshock therapy instead of getting help.
That's right.
So me walking into the door of a service center, a treatment center in 1986, asked for help, was an impossibility in 1960. It wasn't going to happen. There are people in this room that helped make that happen. I thank you. And to be of service to the community that saved my life, I can think of no higher honor. I do want to talk about discrimination. I do want to talk about negative public perception about substance use disorder and how it affects us. Just in the last month, I worked with somebody who went to get Narcan. And Narcan, by the way, is not a controlled substance, and you never use it on yourself. Was denied life insurance, just simply for buying Narcan to use it on another human being. In the last week, I'm working with somebody. We have this, we have a standing order in Pennsylvania that you just go to a pharmacy and you get Narcan, and you don't have to say who it's for. There's a pharmacy in Pennsylvania that wants to know the name of the drug addicts. And I'm saying that the pejorative terminology on purpose here. They want to know the name. Why do they want to know the name? It's not for a good purpose. We're talking about Bethlehem, Pennsylvania. A childhood friend of mine, like a brother. The last time I saw him alive, He was asking for help. I went to the ER to meet with him. When I was there, the psych nurse came in and said, "We're ready to do your evaluation." And I stepped outside of the room. And I could hear the evaluation. And the evaluation went like this. You might be able to get help. It might take all day. But we might be able to get you help. Or you know what? Maybe you could just go home. He was dead 3 months later. It's the last time I saw him alive. She got rid of the Gomer. Get out of my ER. That's how our people are seen. Not by everybody, but by a lot of people. We're dealing with situations where people want our information to help. I got news for you. You don't have to be a doctor to walk into a hospital and see that our hospitals are filled with people with neon signs saying they have a drug or alcohol problem and they don't get help. We have people being denied care for heart valve replacement. We had a situation, we had advocates in this room who brought stories where a mom was told by a doctor, "I'm not going to replace your daughter's heart valve," and by consequence that she was going to die. And the doctor was going to allow her to die because she did that to herself. These are our trained medical professionals. Now, I'm not saying all doctors are like that. I'm sure we have some in the room. We have some good people. But we live in a situation where our information is used to harm us. And we cannot let go of our civil right. And I would suggest that drug and alcohol confidentiality is essentially our civil right. It saved my life. In my decades of working with people, it was also a question that people asked me, what happens to the information? And people aren't going to come and get help if they don't know that their information isn't going to be used to harm them. And I tell you what, the people in this room are what's standing in the way of a lot of moneyed lobbyists who are spending millions of dollars to get our rights reduced. So I'm also asking all of you to work with your elected officials and let them know how important this is to you. And when we do that, when we improve public perception about drug and alcohol health, and the fact that there's nothing remarkable. I mean, I barely graduated from high school. I'm an adjunct college professor. How does that happen? Well, I got news for you. It happens every day in America. The only thing remarkable about my story is that it's unremarkable in the recovery community. The research shows that we get better than well. What other medical condition is there where if you treat it, we get better than well? But we do not treat it. As we change public perception about substance use disorder, maybe we ought to, and I have some informed policymakers, I have some people who've dedicated their lives to bring our system to where it is today, and it's saved my life. I'm not faulting anything that you have done. I'm saying we're not even halfway there. Because the reality is that 9 out of 10 Americans with a substance use disorder never get help. And those that do don't even get the minimum dose of effective care, 90 days. We gotta do better. This is our leading public health problem. The administration says correctly that opioid use disorder is costing our GDP. That's our gross domestic product.
Yeah, whatever.
Yeah. 3%. Alcohol kills more people than opioid use disorders. When you add it all up, this is our biggest domestic problem. We can turn our biggest domestic problem into our biggest domestic asset. Our people is what we need to save. Here's what I'm suggesting. I'm not the first. The reality is, when I hit 5 years of recovery, I had an 85% chance of staying in recovery for the rest of my life. We need to reorganize all our policies, because what we have right now is the subtle bigotry of low expectations. When we provide people less than what they need, we're not doing anybody, but they end up in jails or dead, and it costs us a lot of money, and they're our best and our brightest, and we need to stop that. We need to get people help. And if we start changing, and if we start orienting our research around long-term recovery, and we start orienting our policies, if all our policymakers start with what does it take to get people to 5 years of recovery, and let's start doing that. Like, let's get rid of the IMD exclusion. People have worked several decades on. Let's make sure that recovery support services are paid for in every community. And what we can do is we can make 23.5 million Americans just a good start. Because that's what we are. There are 23.5 million Americans in recovery. I call that a good start, but that's much, we can do much better than that. What it is going to take is to achieve the impossible. For me standing here in front of you tonight is the impossible thing that people who came before me achieved for me. I think we owe that to the next generation. And I tell you what, I am going to work the rest of my life on, if it takes that, is making sure that the paradigm that we care and provide care for people in America is 5 years, and we give you whatever you need. So just like cancer, if one service doesn't work, we'll give you something else. We never give up on you. And then we celebrate, just like we do when somebody's in 5 years of remission from cancer. You know what, you're in full remission from a substance use disorder, and that's something that we should celebrate, and that is what I'm going to spend the rest of my life working on, and I really hope you join me. Thank you very much.